Good to have you with us. You're watching The Big Story with me, Avni Raja. Now, our focus on today's show is the issue of vaccine hesitancy that is being seen in many parts of the country, especially in rural India. Now, we're 5 months into the vaccination program. This is proving to be a big obstacle. Now, in the past 2 weeks, there have been a number of incidents of vaccine hesitancy that has even led to violent confrontations and our healthcare workers and doctors being attacked. In fact, villagers are not just attacking health officials and workers, they're abusing them, cursing them, some even resorting to vandalizing their vehicles. A number of attempts by officials who've gone to villages to try and create awareness also has led to the locals there, the villagers, attacking them as well. Now, we'll bring you such instances from across the country and also talk about what needs to be done to ensure that this vaccine hesitancy issue is overcome. Because remember, vaccination and getting majority of people vaccinated in the country is the most important thing at this point in time. Now, let's start by talking about Bihar's Vaishali, where the situation is quite grim. Villagers have migrated out of fear of the COVID vaccine. Now, after a few people died, allegedly after taking the COVID vaccine, the village is completely empty. Houses are locked. Health officials say that the village is highly influenced by rumors and fear-mongering that is going on.
यहाँ पे सबसे ज़्यादा डर, एक तो कोरोना से 17 लोग एक महीने में मर गए और डर की वजह से जा गए, और भेदभाव, सबसे बड़ा चीज़ है भेदभाव। यहाँ बगल में चक्सी के अंदर बाजार है, कोई अपनी दुकान पर बैठने नहीं देता है, कोई सामान लेने नहीं देता है, लोग भूखे तो मरेंगे नहीं।
कितने परिवार हैं ऐसे, मतलब कितने घर हैं जो लोग यहाँ से जा चुके हैं?
यहाँ पे एक्चुअली 3 घर जा चुके हैं, यहाँ से प्लान कर चुके हैं, जिसमें ये प्रमुख घर है जिसमें 2 लोग की मृत्यु हुई है 24 घंटे के अंदर कोरोना काल से, जिसको वजह से ये लोग दोनों ये प्लान कर चुके हैं।
In fact, that's just one instance that you saw as far as that particular village was concerned. But across the country, there are many parts where vaccine hesitancy is being seen, and it's having various repercussions. We've collated some of these instances to show you the extent of what this is really doing in terms of the vaccine drive. Let's show you these visuals now. Have vaccine hesitancy among people in the rural areas, starting with UP's Itawa, where an elderly woman took cover behind a drum to, in fact, hide herself from health officials, all because she just did not want to take the jab. That is one incident. Then we'll talk about second incident which happened again in Uttar Pradesh. Villagers in Barabanki, they actually jumped into a river, and even after extensive awareness drive that was done by the subdivisional magistrate, they actually jumped into the river to try to avoid getting vaccinated, and as a result, just about 14 people could actually be vaccinated. So that is the second instance that we are getting you as far as these entire instances are concerned. Another incident here coming from Maharashtra, where a team of health workers in Maharashtra's Palghar was sent to spread awareness against COVID in a village. Now, they themselves were attacked. The team included doctors who were stopped from entering the village, and their vehicles were also vandalized. That happened in Maharashtra's Palghar. This is yet another instance we're getting you from Jharkhand, where in Kunti village, an incident was reported. Team of healthcare workers who had gone there, in fact, to address misconceptions related to COVID vaccination, they were attacked by villagers. The circle officer said that numerous attempts to address fear among villagers has gone in vain. So these are some of the instances that in fact have happened. Let's now also talk about the specific incident which happened in Uttar Pradesh in Barabanki, where villagers jumped into a river to evade the vaccine, and also you had this woman who was hiding behind a drum because she did not want to take the vaccine. Let me go across to Alok here. Alok, what can you tell us here? We do know that Uttar Pradesh, especially you've been on ground covering the healthcare situation in parts of UP, especially rural UP, which is a complete mess. And now add to that the issue of vaccine hesitancy, which is obviously becoming a big obstacle. What can you tell us?
Yes, Avni, in fact, we saw that a few months ago when the government wanted to conduct the test on the people were also hesitating for the tests, especially in the villages. And as we are reporting from various places across the Uttar Pradesh, and when we went to villages, we found out that at many people that those who are basically in staying in very poor condition, they are hesitant of taking these vaccines, basically the injection, because what the sense they are, in fact, what the feeling they have. Uh, they feel that if the person takes the injection, then they die. This is what the general feeling and general kind of fear they have, and that is prevailing in various districts, especially in the rural parts of the Uttar Pradesh, and not only in Uttar Pradesh, all across the country. So definitely, the government need to bust this myth that is developing among the people. In fact, many states are also taking many precautionary measures, and they are sending teams, healthcare workers to motivate the people to take the vaccines. In fact, especially in Uttar Pradesh, the ASHA workers and ANM workers have been especially tasked to go and motivate the people and bust these myths. But despite that, at many sections in the rural areas, they are still believing that if they take the injection, then they would die, because there are certain cases in many of the villages. People first developed fever, and then some of them in fact died also. Might be the reason something else, but this fear is prevailing among the people, those basically who are living in rural areas. So government all across the country, all across the state, in fact, they have to take this very seriously, and take some measures and some take some steps regarding this. Back to you.
Right. Alok, you pointed out that one reason that people are fearful is because there have been deaths, and it happened to be people who have got the vaccination. And so that has resulted in a lot of fear mongering and fear among people. But aside from that, are there any other reasons that you have found while talking to people, while you've been traveling within parts of UP and near Delhi even? What are they saying in terms of other reasons that is that is leading to this vaccine hesitancy?
Well, the problem, especially prevailing in the rural areas, because yes, this is the main reason that I am telling it to you, and that some of them are also feeling that because those people who took the injection, they developed fever. So those are the villagers, those who are not affected, or as of now in their family nobody got affected because of the corona. So they are feeling like hum kyun le, that is the feeling that they have. Why they should take these vaccines, why they should take these injection. This is what the feeling in the villages especially, and this perhaps is the reason what I feel that it is
Right.
difficult task for the government
Okay.
to conduct the vaccination in the rural areas. Back to you.
Right, absolutely, Alok. Thank you so much for joining us and giving us that perspective and those details about the kind of situation that exists right now in some parts of rural UP. But let me welcome my guests who are joining in today to talk about this further. Dr. Anand Bhan, researcher, global health, bioethics and health policy is with us, and also Dr. Pradeep Banandur, professor and head Department of Epidemiology, NIMHANS, Bengaluru, and also member of the Technical Advisory Committee Government of Karnataka. Thank you both of you so much for joining us. Dr. Pradeep, let me come to you first. You've just heard what our reporter has spoken about, the kind of instances that I was just narrating about this entire issue of vaccine hesitancy. In your view, what can be done? Because obviously the kind of awareness drives and campaigns is not really working. People are still fearful, and it's ending in our frontline workers and doctors getting attacked.
Yeah, good afternoon and thank you. As we all know, this vaccine hesitancy is a very complex thing and context specific. It can vary by time, place, and different vaccines also. So according to me, there are three things which generally work when there is vaccine hesitancy. One is complacency, the other one is convenience, and the third one is confidence. To me, complacency and convenience is something which is internal to an individual. Confidence is something which we can give as part of the system in terms of communication, information, media campaigns, and things like that. Even then, there isn't this anti-vax or anti propaganda also which works, which is kind of works in social media, different places. You get so many messages from so many, and the convenience component also can be managed by the system to an extent in terms providing vaccination at their doorstep, providing vaccination at the place convenient close by to them, and also at a time when people are available and when it is convenient for them to work. Complacency is something which we need to think about. There are ways and means of getting rid of this complacency. One is peer education or peer model could work. In the sense, if there is a successful vaccine, he can go talk to his own friends and bring them. It's kind of a peer model of community participation, which we could do. I know one of the major global health threats today is not just
Right.
COVID, it is vaccine hesitancy also, mostly because of lack of confidence. And we need to bring in that confidence. There is this thought that we have got 3 vaccines now, there is a 4th one, 5th one coming, maybe that is better. We will wait for other variants to come. All these misconceptions are there and will be there, but the only way is for the system is to give confidence. I think the peer model works very well, or somebody within the family who has got vaccinated could work, because the government, I think, could do more.
Right.
But it has done as much as possible
Right.
in terms of vaccine communication to people, myths and facts, and many things have been
Yes.
done. Still, there is this thought that somebody told and things like that.
Yes.
People believe more with people rather than professionals. That is the problem. That is where we need to, I think, intervene.
Right. Right, absolutely, Dr. Pradeep. Point taken there. The issue of confidence needs to come in with regard to the vaccine. But Dr. Anand Bhan, coming to you here, this is not the first time India is undertaking a massive vaccine drive. We have seen it in the past as well. What do you think at this point is causing this kind of hesitancy here? And what can we do to actually overcome this?
Thank you, Avni, for having me. Yes, we've had run very large immunization programs in the past, and we've had also actually similar experiences in terms of programs such as polio, which were responded to. Those were primarily in some in some local areas, not necessarily all across the country. Now, what we're seeing is a whole series of urban legends. So you're seeing this in large segments of the urban population, also, especially the urban poor. But you're also seeing a lot of rural areas also inundated with these kinds of concerns. And these are largely being driven by social media. So you have a lot of fake news around potentially people getting important, people dying, unfortunately WhatsApp forwards as well. That whole forward around Luke Montagnier, around that if you get vaccinated, you might die in 2 years. That has seemed to, for some reason, really gone viral on WhatsApp. And that is causing a lot of concern among individuals. And this is probably also linked to the fear of the disease. People have seen, especially in the second wave, a lot of death. They've seen a lot of coverage, and that makes them scared about anything COVID related. And on top of that, misinformation around the vaccine, that the vaccine in some way could also be harmful, is probably what is driving a lot of refusal to take the vaccine, even when it is made available. So I think this means that, of course, we have to take this into account. I don't think it helps to only dismiss it as hesitancy or anti-vaxxer sentiment. Sometimes it's not the case. It's just that people probably don't understand the importance of vaccination and are not confident enough about the importance of vaccination, as well as the fact that it is safe and is going to protect them. So I think that messaging needs to be reinforced. As Dr. Pradeep was saying, it largely helps if it is more hyper-local in nature, driven by local leadership. And I think that's what has worked the best. When you involve local faith leaders, when you involve local community leaders, when you involve your frontline workers in a way that you also support them by providing information, then I think that makes a difference. People have tried all kinds of innovative models. Just yesterday I was seeing just outside Bhopal, at one of the truck stops, they have come out with shairi that they're writing behind trucks. And that is one way of engaging, because it makes people talk when they see information. So you need to do that kind of innovative folk songs. You do community engagement, you involve credible voices, and that can help break this cycle of misinformation that we are seeing. If we don't, then I think one of the concerns is that we might see a discrepancy. We will see a lot of good uptake happening in urban India, and maybe largely middle class, upper class India, and then you will have probably less uptake happening, and that will widen the equity issue. Remember also that there is already a gender divide which is coming through. Rural women are especially more prone to misinformation, less likely to have access to information, less access to technology, and that also means that the gender gap within vaccines is already showing through, and that might increase actually if these vaccine fears continue. So very important to try it and address it now. And government, civil society, local leadership, all of us, and the media as well has a role to play.
Yes, absolutely, Dr. Bhan. Extremely important points that you've raised there in terms of what needs to be done, and like Dr. Pradeep was also pointing out. Dr. Pradeep, if you can tell us a little bit, give us a sense of within Karnataka, what the kind of situation that you're seeing in terms of the kind of, if there is, to the extent of vaccine hesitancy in certain parts of the state, especially in rural areas, what can you tell us about the situation there?
Yeah, I think initially it was pretty high in cities, and now with the second wave hitting hard in Bangalore, there is a lot of panic, and a lot of people now want to get in to the vaccination center, and they're ready to queue up and work around things. But as Dr. Ananthan said, there is a gender gap as well, and there is also a rural-urban gap. Now, rural areas where we need to focus more because the pandemic has made inroads into rural areas. There, it is mostly all these myths, rumors, which has got into the minds like wildfire. And I think that is where we need to have look at a context-specific model involving local leaders, engagement locally through different channels is what something is required. We are seeing vaccine hesitancy within a lot of districts outside of Bangalore, and bigger cities like Mysore, Belgaum are kind of low, but just you go to peri-urban and rural areas, we are seeing a lot of vaccine hesitancy, people shouting at frontline workers, people trying to avoid them, running away, they go to the farm and they say they're busy and things like that. So this is known for us from ages, right from the days of family planning to pulse polio vaccination, things are all there. It's not new to us, but here we are kind of one spoiled with choice to this very rapid development of the vaccine itself has given some kind of hesitancy and has driven people into some amount of lack of confidence also. But whatever the amount of science or evidence we populate into their mind, it is always that one extra person who is a very good influencer would have influenced him either through WhatsApp or through informal channels within the villages. So it's a lot of thing, and it's a very complex thing, COVID as well. Yeah.
Yes, yes, absolutely. Dr. Bhan, I want to, come back to a point that you had spoken about, the gender inequality that we're seeing at this point. You're saying it's already showing up. How much, if you can just elaborate on why that could perhaps be happening, because there's also the issue of certain myths that have been floating around with regard to it causing infertility, and menstruating women should not be taking the vaccines. Such kind of myths have been quite, doing the rounds strongly. Do you think that is also a big reason why perhaps less women are coming forward, especially in the rural areas, to get vaccinated?
Yes, that is certainly true. I mean, you have to remember that in India, unfortunately, women's access to health can be often low priority within families. what is prioritized is health of children, and it might be the male members of the family whose health is often prioritized. And this often means that women only access healthcare either when they're pregnant or planning to get pregnant, or when they have reached a stage of a disease where it's difficult to manage, and it's already quite advanced. So that by itself is a factor that women's health is a low priority, often, and unfortunately so. On top of that, you layer on the fact that a lot of information right now is being sourced through technological sources. Information on the vaccination drive, getting access to a vaccination slot, registering yourself, all of that has to be done ideally through a technology interface. And women are likely to have less access to smartphones. They are less likely to be able to access that information, and that kind of a digital divide also means that women are perhaps more adversely impacted. And on top of that, you layer on additional rumors around the fact that pregnant women should not be taking it, or as you were rightly saying, women who are menstruating should not be taking it, and concerns about deaths, etc. It might mean that families end up not prioritizing the vaccination needs of women in their household, and that would again mean that the divide continues to grow. So I think we also need to keep that in mind when we respond, and make sure that our messaging system is also utilizing mechanisms where we can reach out to women. So it could be through local women's health groups, it could be through local leadership in the community, ensuring that women have equivalent access to information as well as are able to access vaccination. And as Dr. Pradeep was saying, perhaps one way to address that also is to bring vaccines closer to the community. If you have to ask community members to go to a facility which is very distant from where they live, then it's also again less likely, given gender and cultural norms, that women will be allowed to go unless accompanied or chaperoned. And that might also mean that lesser women end up actually accessing vaccines. So if we bring it closer to the community, we might be able to also enhance the number of community members, especially women, who are able to access vaccines.
Yes, absolutely. And Dr. Bhan, just another question, specifically in comparison to past vaccine drives that we've seen in the country, whether we talk about polio, and compare it to this, what is the difference that you're seeing? There has been hesitancy even with that, but in your own, with your own perspective, do you think this time it's a little more, or that overcoming that hesitancy is going to prove to be a bigger challenge for this? And it doesn't help here, we're talking about 2-dose vaccines, so that is going to prove to be another hurdle altogether.
It is. I mean, we have to remember that COVID is a relatively new disease. The existing vaccination program is for diseases for which we have known the history, etc. We know those diseases, we know the vaccines for a long time, so people have a certain comfort level. On top of that, here we are launching an adult immunization program. Most vaccine programs in India are primarily for kids under 5 and perhaps pregnant women for TT, etc. So, there is concern. Last year, there was a lot of stigma. This year, perhaps the stigma has gone down, but there is a lot of fear about the disease. And then, you have concerns about the fact that vaccines have come through so fast. Then you have a whole lot of social media campaigns which are targeting vaccines specifically in a negative manner. So all of these probably factors combine, and then you have a higher likelihood that people will be hesitant about COVID-19 vaccines as compared to other vaccines. So again, just you need to have more innovation, you need more community engagement, and you need to acknowledge that it's just not enough to provide the vaccines. You also need to make sure that you enhance demand for the vaccines and get people to agree to take the vaccines. Because, we can increase all the vaccine supply as we want, as we've been discussing over the last many months, including on TV channels. But the vaccination program will only succeed when people take it, both in rural India and urban India. And we need to ensure that people are willing to come forward.
Yes, absolutely. That, in fact, is the crux of the matter here. But Dr. Pradeep, one final question to you. You have, of course, listed out various things and measures that need to be taken to overcome this entire vaccine hesitancy bit. But we are seeing, in fact, in some of the instances that are listed out, where doctors and healthcare workers are getting attacked. We've seen that happening since COVID pandemic hit in various ways. That is one big challenge to overcome, to ensure that the locals, especially in the rural areas, don't get that upset over the whole vaccine issue that they start attacking the people who've come there to help. How does one deal with that?
The The way we have designed this is within Karnataka, I would say, and of course with other vaccine delivery programs which I have experience with. The way we work is we kind of meet these community leaders, both formal and informal, and then talk to them and then sensitize them about the vaccination which we would carry out or which we would do it. And if it is done through them, such instances are very minimal. Along with that, the doctor, although he sits in a primary health center or in a hospital, has access to these villagers or access to these individuals through field workers like community health workers, health assistant, male, female, who are there in sub-centers, ASHA and Anganwadi workers. If we accompany them or if we mobilize people through them, these things come down. And at times, as a matter of emotional things, even our doctors and our healthcare workers tend to become emotional and try to pressurize and force people, become coercive, which to an extent become catalysts for people to become resilient, resistant, and then show up their anger on them. But in Karnataka, such instances like beating people up is quite less. But arguments, heated arguments are all seen. But I think the way we enter the community, the way we approach people, when we introduce new vaccination programs such as this, especially when there are a lot of rumors surrounding them, and there is a lot of bombardment, information, misinformation in social media, everywhere. It takes much more time. It takes much more effort. But I think to me, the best way is to locally reach people through local leaders, local players, rather than reaching. Of course, having celebrities talking about it, having a kind of positive speakers, quotes people, works at the macro level. But in a micro level, I think we should go in for locally influential people, those who seem to be significant, whether it is political leaders or informal leaders or religious leaders, go for them. Our purpose is to protect people, go for it. That would be my...
Right. Yes, absolutely, Dr. Pradeep. Point taken there. Extremely important points that both of you have raised that are crucial at this juncture to ensure that the vaccine drive goes on smoothly. I'd like to thank both of you for joining us and giving us your perspective on this entire issue. The fact, of course, is that while we are focusing on procuring vaccines as much as possible and increasing the vaccine supply, when it comes to certain rural parts of the country at this point in time, it is just as important to ensure that people are not afraid to take the vaccine, their fears are addressed, and the vaccine drive, that's the only way the vaccine drive will progress smoothly. On that note, it's time to wrap up this edition of The Big Story. Thank you so much for watching.